Okay, Assalamualaikum and a very good afternoon to Ms. Nur Farida. Today, me, Adam Zakri, and my group mates, Amar Raiza, Muazzim Shah, Muhammad Arif, and Danish Alias, shall be presenting on the carpal tunnel syndrome. So, without further ado, I shall pass to Muazzim Shah to discuss briefly on the introduction of carpal tunnel syndrome.
Yes, Assalamualaikum. My name is Muhammad Muazzim Shah. Now I'm going to present about the introduction. The first point is carpal tunnel syndrome is a frequent ailment that causes hand and arm discomfort, numbness, and tingling. When one of the principal nerves to the hand, known as the median nerve, is pinched or compressed as it goes through the wrist, the condition arises. The second point is carpal tunnel syndrome worsens over time in most individuals. Therefore, early diagnosis and therapies are critical. Early on, modest treatments such as wearing a wrist splint or avoiding specific activities can frequently reduce symptoms. And the last point is continued pressure on the median nerve. On the other hand, might result in nerve injury and worsen symptoms. For certain patients, surgery to relieve pressure on the median nerve may be needed to provide lasting injury. Thank you. Now I'm going to present to the next presenter.
All right, thank you, Majid. So now I shall explain the objective of this report. The main objective of this report is to explain a brief description of the carpal tunnel syndrome. The description shall include the work processes and the work environment that could lead to the carpal tunnel syndrome. Other than that, this report will purpose the medical and health surveillance related to the disorder. And lastly, this report shall suggest the strategies to improve the health condition of employees suffering from this disorder. Therefore, I shall pass to the next presenter.
Hi, my name is Nukoima Reza, and now I'm going to talk about medical surveillance. Medical surveillance is the analysis of health information to look for problems that may be occurring in the workplace that require targeted prevention. Surveillance serves as a feedback loop to the employer. Surveillance may be based on a single case on sentinel event, but more typically uses screening results from the group of employees being evaluated to look for abnormal trends in health status. Surveillance can also be conducted on a single employee over time. Review of group results helps to identify potential problem areas and the effectiveness of existing worksite preventive strategies. Carpal tunnel size was examined as a risk factor associated with a carpal tunnel syndrome in workplace. 7 of 14 electricians had symptoms of carpal tunnel syndrome. When cross-sectional areas were measured by computed tomography, also known as CT, affected workers had a cross-sectional area of 1.75, negative 0.21 cm square. Control values were 2.53, negative 0.15 cm square. Subjects with a subclinical syndrome had an area of 1.83, negative 0.22 cm square, which was similar to the group with symptoms. Wrist circumference was not a predictor of the smallest carpal tunnel area. Unusual bony and soft tissue structures within the carpal tunnel were easily identified with CT. That's all for me. I'm going to pass to the next presenter.
Okay, hi, Assalamualaikum. My name is Daniel Iskandar. Today I will explain about health surveillance for carpal tunnel syndrome. Health surveillance is making a checkup for worker by doctor or other health occupational. For carpal tunnel syndrome, it came from an awkward posture of hand and from a repetitive movement of fingers and cause irritation and swelling of tendons in carpal tunnel, leading to impingement of median nerve and median nerve. The median runs to the forearms, down to your hand and into your upper arms. It's someone, the patient will feel numbness onto their hand and tangling fingers. The workers who experience carpal tunnel syndrome will cause inflammation, injuries, and makes it hard for nerve to travel through. Most person will get the carpal tunnel syndrome is women because most likely um, women is tend to do much more repetitive movement such as typing, swing, sewing, and more. And to avoid the syndrome to happen to employees, companies should call a doctor to make a checkup for all workers that most likely will get the disease. By doing the checkup, it can prevent the worker from taking long leave for a long period of time. I think that's all from me.
Hello, my name is Muhammad Arif bin Yusri. Today, I want to explain about strategies to improve the employees' health condition. Health lifestyle. A healthy lifestyle period is the key to a healthy life. The key is to preventing capture. Yeah. The key to preventing capital tunnel syndrome is to live a healthy lifestyle. Encourage your staff to do regular office exercise, particularly rush exercise to improve their mobility. Furthermore, unhealthy behaviors such as smoking impede blood flow, resulting in carpal tunnel syndrome (CTS). Controlling CTS also necessitates maintaining a healthy weight. You might start a weight loss challenge in the office to get rid of the extra pound. Warm hand. Keep your hand warm at all time when working, and workplace sitting might be quiet, chilly in some instances. This frigid environment might make your hand numb. As a result, keeping the hand warm is critical. In this case, you can equip your staff with hand gloves to keep their hand warm. Next. Loose. For loose grip, employees may use a firmer grip than necessary when using office equipment at times. This don't seem correct because a strong grip causes hand stress. As a result, personnel must use office equipment with a relaxed grasp whenever feasible. For breaks, carpal tunnel syndrome (CTS) can also be caused by working in a repetitive motion for a long period of time. To avoid CTS, your staff must take break from time to time. Employees would benefit greatly if they could do some workplace stretch during their break. You can shake off the collective anxiety by shaking your hand here. You may also make a stop sign by blowing your fist and then extending your finger skyward. As a break time activity, one might also fan out or extend their fingers as far as possible. Okay, thank you.
Hello, my name is Ruben Alakisivan and I'm from Demos for A. And I'm here to continue the strategies to improve the employee's health condition. Posture in the first place, posture makes a tremendous impact in handling CTS. As a result, your staff must maintain good posture during work. It is it is also critical for them to comprehend the monitor chair, keyboard, and more location in the regard. To enhance workplace ergonomic, all of the factors started above should be within early reach of employees. The goals here it is to avoid sleeping outside one's uh, comfort zone in order to get to these items. Secondly, straight wrist. Most employees acquire their own distinctive routine while typing away at their computers. The most typical example is typing with the wrist facing up and down. This is a factor that employees that consider in that type. Workers should aim to maintain their wrist natural, which means working with a straight wrist to relieve straight on the median nerve. Wearing a wrist brace while sleeping night uh, also assists in the maintain a straight wrist. Thirdly, a proper setup. When it comes battling CTS, having the right configuration helps a lot. Adjusting your keyboard height so that you can work with straight wrist is an excellent habit to get into. As the employees type, make sure their elbows are close to their sides. If the condition has progressed to the point that prevention is no longer an option, you must seek prompt diagnosis of carpal tunnel syndrome. Applying an ice pack to relieve pain, wearing a wrist splint, and taking anti inflammatory medicines are all